Every week, a new skincare ingredient goes viral, a new serum, a new peptide, a new miracle molecule that promises to fix everything. But what do dermatologists actually recommend? Not influencers, not brands. Dermatologists, 62 of them, across 43 institutions, who reviewed 318 ingredients and reached a scientific consensus on which ones actually work. The list is shorter than you'd expect. In 2025, the Journal of the American Academy of Dermatology published a consensus study on skincare ingredients. The researchers started with 318 ingredients currently available in over-the-counter and prescription products. A first panel of 17 expert cosmetic dermatologists reduced this list to 83. Then, a second panel of 62 dermatologists across 43 institutions completed 2 rounds of a formal consensus process, rating each ingredient on a scale from 1 to 9. An ingredient made the final list only if at least 70% of dermatologists rated it highly, and no more than 15% actively discouraged its use. The result: 23 ingredients across 7 common skin concerns. So what made the list? Let's go through all 7 skin concerns. Fine lines and wrinkles. 4 ingredients reached consensus. Mineral sunscreen and retinoids, both at 96.8% agreement. Vitamin C at 88.7% and chemical sunscreen at 82.3%. The message is clear: protect first, then repair. Acne, retinoids again at 96.8%, benzoyl peroxide at 95.2%, clindamycin at 90.3%, salicylic acid at 93.6%, azelaic acid at 87.1%, and glycolic acid at 79%. These are not new discoveries. They are well-studied, evidence-backed, and consistently effective. Redness. 7 ingredients reached consensus, the most of any category. Mineral sunscreen led at 95.2%, followed by sulfostamide sulfur, metronidazole, green-tinted products, brimonidine, niacinamide, and ivermectin. Dark spots. 8 ingredients, the largest list. Hydroquinone at 98.4%, the highest consensus score in the entire study. Retinoids at 96.8%, kojic acid, glycolic acid, azelaic acid, vitamin C, tranexamic acid, and niacinamide all made the cut. Large pores. Only 1 ingredient reached consensus, retinoids, at 93.6%. Dry skin, 5 ingredients: petrolatum, ceramides, ammonium lactate, hyaluronic acid, urea. Oily skin, 3 ingredients: retinoids, benzoyl peroxide, and salicylic acid. Now the findings that stand out. Retinoids dominate the list. They reached consensus for 5 out of 7 skin concerns: fine lines and wrinkles, acne, dark spots, large pores, and oily skin. The evidence spans decades and multiple high-quality randomized controlled trials. No other ingredient in this study comes close in terms of breadth and strength of evidence. Sunscreen is more than photoprotection. Both mineral and chemical sunscreen reached consensus for fine lines and wrinkles. Mineral sunscreen also reached consensus for redness. Daily broad-spectrum sunscreen use has been shown to reduce skin aging both clinically and histologically, making it not just a preventive measure but an active treatment. Hydroquinone is well supported for treating dark spots and hyperpigmentation. The panel noted that combination therapy tends to outperform hydroquinone alone and that its irritation potential means alternatives may sometimes be preferable. For dark spots, multiple alternatives also reached consensus. Tranexamic acid stood out, comparable efficacy to hydroquinone with a significantly lower risk of irritation. Kojic acid, glycolic acid, azelaic acid, vitamin C, retinoids, and niacinamide all made the list as well. For acne, the fundamentals still lead. The panel noted that benzoyl peroxide helps prevent antibiotic resistance when combined with topical antibiotics, a clinically important point. What didn't make the list? DNA repair enzymes, growth factors, and peptides, all widely marketed and present in expensive products, did not reach consensus. The evidence supporting their efficacy for common skin concerns was considered insufficient or preliminary. The panel also specifically noted that cost influenced some recommendations. Affordable, well-evidenced ingredients were consistently prioritized over expensive options with weaker data. What this study offers is clarity, not a complete routine, but an evidence-based starting point from experts who treat skin for a living. The core message is straightforward. Retinoids and sunscreen have the broadest and strongest evidence base of any topical ingredients in cosmetic dermatology. Beyond those, the right additions depend on your specific concerns. As for the ingredients that didn't make the list, absence from this consensus doesn't mean ineffective. It means the evidence isn't there yet.